Welcome, folks, to Season 6, Episode 1 of Gateway Center of Excellence in Rural Health's lecture series, where we are opening the gate to understanding of rural health. Today's date is September 9th, 2025, and the topic is the future of health forecasting, technology, disease mitigation, and community empowerment. My name is Sage Milne, and I'm your moderator for this webinar and a research assistant at Gateway. And I'm so pleased to welcome a group of local health entrepreneurs. Alexandra Kasper, Alex, is an EpiSense co-founder and operations lead. She has a master's degree in biophysics and another in educational technology. She has experience in government project management and digital product development. Michael Daley is an EpiSense co-founder and external relations lead. He has 15 years combined experience across banking and technology sales, and Michael was recently recognized as the top account manager at a Fortune 500 tech company. This webinar will explore technology and how it can provide early insights, support proactive prevention, and empower healthier and more resilient communities. Before we begin, I want to acknowledge the land. Gateway is an organization dedicated to promoting health and well-being for the diverse communities that call rural areas home. This can include rural, remote, and Indigenous lands that continue to face inadequate access to health and healthcare services. The views and opinions in this webinar of the speakers may not reflect Gateway's, but we believe in providing a platform for meaningful discussion. Furthermore, this webinar is not an official endorsement of EpiSense as a product, but rather Gateway believes in promoting understanding about rural health innovation, new technologies, and local resources. So I will ask now Michael and Alex to introduce yourselves further and explain to the audience what is EpiSense.
Well, thank you very much for the warm introduction, Sage, and we're very happy to be with everyone today to kick off the fall season of the Gateway Center of Excellence in Rural Health monthly webinar series. We might want to find a way to shorten that, Sage. It's a real mouthful. Alex and I are truly humbled to be here today, though, to speak about the future of health forecasting. And over the next 30 to 40 minutes, we hope to share how companies like EpiSense are partnering with communities to change the future of healthcare. So let's begin with the problem that we're all feeling, but we can't always see clearly. Our healthcare systems are stretched to their limits. Communicable diseases often circulate quietly, almost silently in our communities, spreading from person to person long before we become aware of emerging health issues. Our systems are strained right now. Ontario healthcare's capacity is already under immense pressure. As of the latest data, at least 2.3 million Ontarians don't have regular access to primary care. That's roughly 1 in 6 people in our communities without a family doctor or a nurse practitioner to help guide their health outcomes. And the reality is, getting sick disrupts your life. When illness strikes unexpectedly, especially in a system that's already under-resourced, it can shatter our routines. Parents scramble for healthcare, schools struggle with coverage, and caregivers have to pivot rapidly to support vulnerable family members or patients. And in the current climate, this can be a breeding ground for misinformation. In the absence of timely, reliable health data, speculation fills the void. Misinformation spreads often faster than the illness itself, which can drive confusion and alarm in our communities. All of these challenges point to a common thread. It's not just about the illness per se, but about how our healthcare system's fragility magnifies the impact of these diseases. And this begins long before official alerts go out. And that's why today we want to talk about being proactive with real-time solutions that can be critical to our success. Now, let's not forget the human impact on all of this. We can really bring this home personally. When illness strikes unexpectedly, as a parent, it's very disruptive. It doesn't stay hidden. and it cascades through our lives. The reality is, if my kids are sick, my wife or I have to miss work. And imagine a parent whose child wakes up with a fever or cough, not uncommon in my world, and a single day of school or daycare coverage gets missed, and that means a day off work. Now, for me, I'm really blessed for the company that I work with, but scrambling for backup childcare is not an easy thing to address, and it can also impact just the paychecks and your peace of mind as a family. And of course, it's not just parents that are impacted by sickness. Long-term care facilities scramble during outbreaks, and it's not their fault. During the COVID pandemic, Ontario's long-term care sector endured some of the most devastating outcomes. Nearly 2,800 residents passed away during the outbreaks that could be attributed to COVID. That's a tragic outcome and one that we don't want to see repeated again. And it's because long-term care has unique challenges. We know that residents typically live with multiple chronic conditions. It's an average of 6 different health issues, and that adds up to around 11 different medications. And these patients that are in long-term care are there for reasons. They often struggle with moderate to severe cognitive impairments, various other health conditions, and this creates heightened vulnerability for these individuals. So when illness hits these homes, it impacts the staff, it impacts the patients, and it impacts the families that trust these facilities with their family members. And of course, since we're talking about rural health today, that's a whole nother layer that we have to deal with. Physician shortages are a reality for us, and our infrastructure is aging. And we have a lot of great organizations that try and shore this up, whether it's through long table dinners to get the equipment we need, or various community organizations that try and attract physicians to our areas. But that remoteness creates a challenge. More than 500,000 people in Northern Ontario's vast landscapes right now have there's less than 1 person per square kilometer. And that makes it really challenging from a healthcare perspective. That doesn't even begin to scratch the surface on mental health challenges and the resources that are just less accessible in a rural community. And finally, it's important to know that right now, Ontario physicians, we only have 2.8 doctors per 1,000 people in Ontario. And with a wave of retirements just around the corner, that's going to strain our system even further. So one of the things that we think of at EpiSense is, well, what if we knew these things sooner? It echoes across these disruptive periods of time. And when you experience delays in your healthcare system or can't get the care that you're looking for, there's a very real gap. And we're hoping that we can utilize technology to proactively address that. I'll turn it over to Alex.
Yeah, thanks. Michael did a great job, I think, of kind of setting the scene and saying some things that a lot of us, I think, feel deeply, but also backing up with the data that supports this. So who are we as a group of individuals at EpiSense, and what gives us the right to essentially invite ourselves to the table and start talking about some of these issues? So at this point, EpiSense is a 3-founder team. So we are a team of 3 of us. All 3 of us are parents. Between us, we have 4 children, and we're also what people sometimes call the sandwich generation. So also, all 3 of us also have parents. My grandmother's still alive, who's 96 and still lives in her own home. And so we really see kind of from all angles, let alone actually thinking about our own personal health when we have time after taking care of our children, our parents, and our grandparents. So we have sort of personally felt this challenge. And then through kind of many conversations over the past couple of years, we said, you know what, I think we have a combination of skills to bring something to the table and try to kind of find our niche in this ecosystem. So our technical lead, Dr. Karosek, brings the technical expertise. So his PhD is in physics and he is currently working as a researcher at the University of Guelph in the Math and Stats department, studying diseases and immunity research, as well as supply chain dynamics for vaccine distribution. And so he has 10 years experience in the data side of things, exploring new applications of AI and machine learning. And essentially, he's our numbers backend guy. And then Michael on our team, he's our relationships guy. So Michael is amazing at bringing people together. He also comes from a background in the tech space and seeing these products go from idea to market and how to engage people at all angles. And then myself, Alex, I wear the hat of sort of our product management and also some project management, customer service emails. I kind of fill in the gaps between Chapin's side and Michael's side with all the things needed to happen with the business. And I also have, like Sage mentioned, my master's in educational technology and learning design, which I try to bring that expertise to the table because, as we'll talk about further on, there's a really big public education piece to all of this work for people to engage and be learning. Ultimately, it's a tool for learning, what's going on out there, what should I be doing, kind of leveraging some of the knowledge that I learned through that master's of creating a technology that's also a learning tool. So today we're talking about disease forecasting. And so we wanted to do a little bit of an intro because not all of us might know exactly how this works. So at the big picture, you have this flow of inputs. So you need data to power this forecasting. You have a diverse amount of inputs, which ultimately feed in to the code, the modeling, the analysis, and also the interpretation of what that model's spitting out to give us some outputs. So that's, what are the current levels? What are the predictions for the next few days, the next couple weeks? And disease forecasting, you can really draw from the analogy, it operates really similarly to weather forecasting. So when you're thinking about this, right, you as a consumer can check your weather app every single day. You can see there, what's the temperature right now? Is it going to rain tomorrow? You use that to make your plans. So you're used to seeing these types of outputs, but in the back end under the hood, that there's a lot of computation models. There's a lot of meteorologists and modelers and kind of coders in the background doing this analysis. But for their models to be accurate, they need this raw data. So in the context of, weather forecasting, we know there's weather stations all over the world, which are giving them real-time access to the temperature, the humidity, the wind patterns, and all of these things in real time are feeding into these models. And so if you want to have the best possible outputs, so in our case, you want to know, like, what are disease levels right now? What are they going to be? You kind of have two knobs you can turn. You can increase the quality of your modeling. So you need a good model. You need to continuously be revalidating that your model is tuned right, that you have the right controls in it, that you're interpreting it correctly, which that's a piece of the puzzle that researchers in academia and researchers at the federal government and within EpiSense Chapin work on to understand how do we apply new technologies, for example, machine learning algorithms that can improve these models because they are, experts at pattern detection. But ultimately, you can have the best model in the world, but it's not going to give you accurate outputs if you don't have those real-time inputs. And so the inputs that we currently have access to as kind of a group in the worlds of disease forecasting include things like public health's published case count data, which is released weekly and is available to anyone to get online. There are also additional reports that come out sometimes when there's specific outbreaks. There'll be more detailed reports coming out of public health units. You can also do interesting things. There's a lot of research during COVID correlating. You can kind of scrub social media, and if there's more posts on social media about people being sick and people saying certain symptoms, you can correlate that with spikes in their area. So that's also a type of input you can feed into your model. But one of the sort of gaps is, what is the equivalent to the weather station? What is the equivalent to knowing right now what's the temperature, what's the humidity, and what is the wind pattern? And that's where there is a challenge with disease forecasting, because a lot of this public health data, which is high value, high accuracy case counts are often a week or two delayed. So you can imagine by the time, so the public health case counts are based on like diagnosed confirmed cases, for example, of influenza A. So you have to think back in time, well, how would they have gotten that case count to report, in this spreadsheet that's available online? There was an individual person who started exposed to a disease, who started having symptoms. That might have been a few days. The disease takes hold in their body, gets severe enough that they either go to their family doctor or they go to a walk-in to a clinic or the emergency department. They need to get swabbed. They need to get confirmed that that is actually influenza A. That data point gets put into a spreadsheet, and then once a week, that case count data is reported. So this is where, from the time that the person started experiencing symptoms to the time that that data is available to feed into the model, can be up to 2 weeks delayed. And so that has inspired us to say, well, how can we get better? How can we go more direct to the source? Essentially, people are in the community experiencing symptoms. Where is the channel to get that as an input into our models? And so that was what has inspired us to look at parallels with these community-driven and community-enriched technology that we can be inspired from other sectors that Michael's going to tell us about.
Thanks so much, Alex. Yeah, the power of the community enhanced technology is really kind of an exciting concept here. And I think it's something that oftentimes just goes under the radar. We forget that we're even engaging and participating in this on a daily basis. So whether it's something like Airbnb, which has totally changed the way that people structure their vacations and look for homes, or something like Wikipedia, where you're able to access the world's knowledge, like a few clicks of a button. It's absolutely imperative that for these systems to work, that we have people engaging and reporting. And as we started to think about this challenge as it relates to the healthcare space, we know that really there is an underreporting of the cases in these incidents, and it's because it's very difficult for the community to engage. And it's absolutely critical that we have people participating as part of this. So it's not just the data from the inputs on the reported cases that we're seeing collected by our hospitals and the local government. It's that we need to get deeper into this and have an easier way for people to report directly. For those of you who have the pleasure of utilizing something like Uber outside of Huron County, obviously, it's an absolutely magical way to get away around when you need public transit. So this is just revolutionized the way that things work in that we've now have a device in our hands that allows us to call out to a device looking for the fastest, most economical way for us to get from A to B. And we want to be able to do something similar in the healthcare space. So that's sort of why we're not entirely relying on the systems provided to us. We think our government agencies do a great job. We're all very proud to be Canadians that have free healthcare. But we recognize that there's this gap in the system by utilizing
So Michael is frozen on my end, and I don't know, Alex, if this is the same experience you're currently having.
Yeah, I was wondering if it was me that was frozen, but
Pardon?
Michael froze to me. Oh, there. Michael, you froze to us for a bit.
Okay. So what I was saying there is that these platforms really enable us to not just connect through the technology itself, but with those engaged community members. And it really strengthens the platform that we get to work across.
Yeah, so when we look at and we can be inspired by, how this has applied to, the industry of transportation, the industry of connecting. LinkedIn has revolutionized the industry of how people network and get jobs and change jobs. And so we need to look at some of the unique challenges and also what are the similarities in the healthcare sector and the healthcare landscape. So this is a little bit of a reflection when it comes to these kind of data driven technologies, what is similar and what are some challenges in the healthcare space. So as we know, in Canada, our healthcare system is actually quite a diverse ecosystem. So there's no one single body. You have a lot of different organizations that come together to create this ecosystem. So for example, a lot of the face-to-face care to patients is handled by practitioners, so our doctors, our nurses, our frontline staff, but then they are also supported by public health resources and planning. There is also a lot of research going on in our universities around clinical trials and also more theoretical research like mathematical biologists. You have the advocacy work that is informing and shaping policy. You have extra support systems like non-government organizations and people also like Gateway who are trying to mobilize knowledge and connect people. And then you also have private companies. And so when you talk about technology innovation in the healthcare space, it's important to remember the context of why this can actually be really challenging and why sometimes it's a little bit slower or has some challenges that are unique to healthcare. So one of those challenges, for example, is around just the nature of the data. So healthcare data is some of the most sensitive and like privacy requiring data around, right? Like it is not appropriate for practitioners to be directly sharing case files of patients with companies directly. Like that is entirely both illegal and not endorsed. And so you have to think creatively around how can we look for, population level trends or local trends, and then have this ecosystem working together in a way that is still compliant and actually even beyond compliant, but above the board on making sure that we're protecting the people that are the most at risk and have the most to benefit from these technologies. So during COVID was an interesting time because it really drove a lot of technology innovation in healthcare, right? So there's some technologies that were beginning to take shape, and then COVID just kind of, poured fuel on that fire. So one example is telemedicine. It was sort of getting going beforehand, this idea that you could remotely access, meeting with a nurse or a doctor from your computer. And then COVID just really, amped up the development time on that, where you need these private service providers and companies essentially to be building these platforms and then giving out the licenses. You need practitioners to be on board to be comfortable using these and support these. You need potentially some changes in policy and also endorsement from different groups saying, yeah, we believe this to be safe and it conforms with our policy, our privacy requirements. And so this is why it's not just like an overnight thing necessarily to have these technologies take off. So while COVID was a good sort of experiment, there's still a lot of way to go. So I think during COVID was also a time when people said, well, what else could we be doing? And so we saw this idea, which was really well intentioned as well, around the contact tracing apps, right? So this idea like, well, everyone has their cell phone in their pocket, and cell phone companies are already tracking this information. They know where you are and what you're doing and how long you're spending and pinging off if you're near someone else's cell phone. Why don't we just take that data and now we could do so much with it? And so that was a really well intentioned idea, which then kind of in practice set off a lot of warning bells of privacy violations and concerns, and people thought, well, no, you can't just do that. Like, wait, let's back up a step. And so we as EpiSense are kind of sitting back and going, okay, what can we do to help mobilize some of this data and collect actually like high quality data directly from people that doesn't kind of circumvent asking people's permission? And so the answer is you go directly to the people. And so that's really the perspective that EpiSense is taking, because in sort of my circles here, the one group that's not represented is the biggest group, which is the individual patients, the individual Canadians. And so we both stand to benefit from our healthcare system, but we can be more active participants. And so, yeah, this got us thinking about how is this data currently being mobilized? Yeah, like right now, it's a lot of word of mouth, right? You might know a disease is on the rise because your friend said so, or your mom saying, oh, Karen said she was out with the flu, and then Helen was out with the flu, and so we thought, how do we take word of mouth and bring it to scale? And so some of the real world benefits of this dream that we're working towards of being able to see real time disease levels, for example, can impact school boards. So, for example, they could adjust their protocols, ramp up efforts to line up maybe some supply teaching, or even like extra reminders about hand washing and safety protocols in schools. In long-term care, you just have that bit of notice. Maybe you're staffing up, maybe you're putting in extra protocols, maybe you're administering some preventative medicines, for example, like Tamiflus. And then as families, it gives you opportunity to maybe line up some extra childcare, check in with your loved ones. So, for example, if you have an infant under the age of 6 months, RSV is extremely dangerous for your young one. If a baby gets RSV, whereas if you're not immune compromised and you're older, RSV is less like life-threatening typically, but you're really it's like you're top of mind as a mom and a dad when you have that little one. And so if you were able to see your community's level RSV, that can help inform your decision, like, okay, maybe we don't take the baby grocery shopping this week. Like maybe we either do the pickup system or send somebody else, ask a family member or friend to pick up our groceries, to just kind of shelter ourselves a little bit more when you know that these things are out there. And then in terms of rural health, we know that disease spread is not uniform across our whole region. Here in like Huron, Perth, it's a huge amount of area, but we know active disease levels are not going to be the same in Goderich or Clinton or Stratford all simultaneously, and having that line of sight can help also triage some resources as well. So that's sort of what we're working towards, the vision of some of the real world benefits if we can make this a reality.
Yeah, and that goes right back to having the informed citizen. So if we take that idea we had of the community and enhanced technology and we apply it to health, we get something really powerful. So as mentioned earlier, there's 2.3 million Ontarians who don't have a family practitioner right now. That's a major gap in the system. So instead of being a passive recipient of data or updates, citizens can become active in this uh, project of ours. So when you're active in it and you're providing that anonymized data, you're helping each other anticipate and prevent those illnesses. So if you take the example of being a parent, knowing that the flu cases are spiking in your area before it actually comes home and disrupts your life can be a really powerful tool. You might decide, I'm going to keep my child home from school today, or I'm going to make sure that my child is washing their hands before and after they leave the home. And you can apply similar ideas when it comes to long-term care facilities. So if you have an engaged long-term care director who is able to see signs of RSV spiking in communities surrounding them, they can more effectively address the potential challenges there. Whether it's implementing new policies, if it's looking at revising staffing numbers, all of these things can improve the healthcare outcomes that we're looking to achieve. So this is really like a real shift and transformation. So we're going from being surprised and scrambling when we get this information to having foresight and implementing various preparedness measures. And from a personal perspective, I don't love being caught off guard by things. If I can get a little bit of information in advance, much more receptive to the potential outcomes if they're going to have negative connotations there. So what we're really looking to do is making sure that people are informed. And by doing so, you're not just protecting yourself, but you're also strengthening the entire community around you. And every informed citizen becomes part of this solution. So we avoid sort of selling through to you guys right up until now, but we wanted to spend a little bit of time talking about what makes EpiSense unique. So as Alex mentioned, we're designed to be a weather app for disease. We want it to be a simple and clear way for you to see what's circulating in your community, just like you would check the forecast. And we're not trying to be prescriptive about this either. We still want citizens making their own decided information or decisions about this. So if you see in the forecast that it's raining, maybe you'll choose to reschedule that picnic, or maybe you'll look for a place with a pergola. It's entirely up to you how you choose to use that information. And what makes us sort of uniquely qualified to help with this is going back to one of our co-founders, Dr. Chapin Karosek there. Um, this solution's been designed by an epidemiologist. So it's scientifically rigorous and yet it's user-friendly. Whereas right now, what's available in the market is heavily data-driven and it's not accessible to people like you and I. Adding the localized component is also extremely powerful. So if Chapin was here, he would talk about the forward sortation area, which is really just the first 3 characters in your postal code. And that's what allows us to differentiate the challenges in Goderich versus Cornwall. While they might seem like similar communities at first glance, there is a geographic difference there. There's differences in the population itself. And by having this information reported to us anonymously, we're able to make more powerful predictions that can help improve these outcomes. And it's really designed to go beyond just the numbers themselves. Chapin is happy to look at spreadsheets all day long, and we're very blessed to have him as part of the team. For me, I want like a paragraph of information telling me what's happening, and that's why we provide something like the EpiSense newsletter that we provide weekly with an update. So you're getting a snapshot of what's happening in the healthcare space. And it just goes back to making this information very usable and practical for everyday people. We're not all data scientists. We're not all epidemiologists, but we feel that we can really empower people by putting this information in their pockets.
Yeah, so coming back to the kind of earlier flow that I had around how these forecasting works, and it all comes down to the better outputs you want is all driven by the inputs. And so we are trying to think about our user engagement cycle because we are only ever going to have as good of a dashboard as the data that's feeding into it. So we really need to grow this strong user base that, represents your community. It's not enough that it's only a certain slice, like 25 to 45-year-olds. We need to have a community engaged that represents the actual community that we're trying to report on. And so that starts with building trust and collaborating with partners in the area and collaborating with individuals in the community. And so our perspective on this, kind of our guiding philosophy of how are we growing this community, is about starting with trust and collaboration as a pillar. So that's why we are so glad to be here today and starting our collaboration with Gateway, but also starting those conversations with individuals as well, because we all need to buy in to this idea that when we all contribute to sharing this data anonymously by saying, hey, I'm not feeling great, the same way you might mention that to your neighbor or your cousin, that is able to be mobilized and put into this modeling analysis so that we all stand to benefit from a stronger picture of the real-time levels and the forecasting. And so whereas some of the other initiatives that are asking people to report on symptoms, there are some other places that are out there, they don't necessarily have that value given right back to the consumer. So we want to have that this dashboard's available, you're directly benefiting from this. That's kind of like those blue arrows. So the person at the middle gets to see that dashboard. They see the benefit and are directly able to use that. So now they're incentivized and feel engaged to be continuously contributing to the inputs. And this screenshot of our dashboard Michael showed, there's actually 2 buttons. So it's not just tell us when you're sick. It's also about, check in, daily, weekly, as much as possible to also tell us you're healthy, because that's going to be what statistically allows us to notice when signals have spikes in them, is we need this baseline of people saying, okay, maybe baseline, 1% of people in Goderich are reporting feeling unwell compared to healthy, but now all of a sudden, in the past 24 hours, we're seeing that spike up to 5%. That's a signal to start informing the model and changing things. And so, yes, this is sort of our philosophy to how we are approaching our business and wanting to really put our customers at the center of the whole picture here, to making sure that if we want to ask them to essentially contribute and share their data anonymously to feed this model, they need to be deriving direct value and see themselves as part of this bigger picture. And so on the next slide, a piece of that building trust and is also through building trust through joint understanding. So this is where the education piece that I mentioned came in as well. So it's not just the disease levels, but also in the dashboard, there's a little icon with a little eye on it. So anyone can click on that if they say, well, what, like, I keep hearing about measles in the news, but like, what is the measles, right? Like, what really is that? Or, there's influenza A and influenza B. A lot of people don't know. What's the difference? Like, why are you talking about influenza A and B? And so we're trying to embed these kind of digestible pieces of, fact-based scientific information about these diseases to help people better engage and better understand what we're talking about. Because we know that when people don't understand or when they're confused, that is the kind of ripe conditions for misinformation and mistrust to really breed, is when people feel like they don't have the full picture. And that also is what feeds people's anxiety and stress, is when you're sort of hearing this panic signal, measles is high. But it's like, well, okay, well, what is the measles? What does high mean? And so there's an education piece embedded within our kind of platform as well around, well, what are the levels? What does it mean to be high versus low? And why does that maybe differ than disease to disease? So we're building out our FAQs, which are all informed by questions that our users have been asking us. And in the near future, we want to expand to have more articles that are less time bound kind of updates, which is what's in our newsletter, but more general information. Like people are often curious, well, how come some vaccines you can get, the regimen and now you're good for life, whereas something like the flu, you're being recommended to take it every year. And so there's science behind, why certain vaccines are updated annually and some vaccines are good for life, but exploring those in a kind of public audience accessible way so that people have the information in their pockets to use. And this kind of model also comes back to a little bit of like education theory with around just-in-time information. So if you kind of throw too much information at people at once, like your brain shuts down. You don't really know what to do that. You don't have context for how to apply that information in your current life. So we're following this philosophy of just-in-time information where people kind of can ease into it and explore and gain more information when it's applicable to them. So yeah, that's sort of where our education piece is coming in as well.
Yeah, thanks so much, Alex. Yeah, and all of this really comes down to envisioning a healthier future together for us. As much as we'd all love to snap our fingers and have the appropriate number of doctors in our communities, the reality is that's not going to happen anytime soon. It takes a long time to train up a doctor, and it takes a long time to recruit them to your various communities. So we know that illness is still going to happen, but the idea is, instead of scrambling, whether you're a family, a school, or care professional, we want to see it coming and we want to be able to prepare. And we want to get away from this misinformation, which has really become a challenge in today's society. And we want to be able to fill that gap with trustworthy, unbiased information that's localized to help you guide your choices. And the best way to do this is combining both that technology and the citizen input, having your communities engaged. It's a really simple but powerful formula. The technology is giving us the tools, and our people who are contributing and providing those inputs makes our system smarter, and we can make more informed decisions together. So when you're contributing, it's not just for your own benefit. It's also helping those people around you in the community. And that helps build resilience. So it's not just handed down from the top anymore. We're not reliant on sort of one potential provider, one leg of the stool. It helps us have a more resilient system in general. And our vision, again, is making checking for your illness trends in your area as simple as looking for the weather. we think this is something that will benefit parents and schools, rural hospitals, employers alike. There is a ton of data around how much it costs the system when someone's not able to come into work. And these are all things that we can help shore up by having this partnership of the technology and the community working together. So we want to thank everyone who's participated today. We really appreciate you listening to us. I know that these can be complex topics. Some components are more exciting to you than others, so we appreciate that. And before we turn it over to Sage for some Q&A, we just want to extend an offer to you to go register for a free trial of EpiSense at episense.ca. Right now, it's free until November 1st. And in addition to that, the newsletter that we put out on a weekly basis is always free. After that time, subscription is just $3.99 per month. And we've seen some really exciting feedback from our existing clients, and we hope that we can continue to build this out. With that, Sage, I'll turn it back to you.
Well, thank you, Alex and Michael, for sharing about what drives you locally as Huron County residents in developing a business in modeling health as a weather forecast. So, as Michael said, if you do have any questions, I encourage you to add it to the Q&A box down below. And we actually already have a question, which I am going to direct towards Michael. Do you have advice for rural innovators regarding how to develop funding sources in the private sector without relying on government sources? They're thinking about, hey, if we want to look at what you're doing within health, how can we apply it to stuff that has to do with the environment and environmental health sector?
Yeah, so full disclosure, Chapin, Alex, and I all have full-time jobs still. And so far, EpiSense has been entirely self-funded. That said, we did have the opportunity to participate in a startup accelerator called Tree Frog, which is out of the GTA. And that was extremely valuable in giving us some of the skills we need and tools to get the company off the ground. We also had a lot of interest from potential investors early on. But we surrounded ourselves with some good advisors, and their guidance to us was uh, take this as far as you can with your own funds, and that way you're more in control of your destiny. Um, but having that network in place will be extremely invaluable to us in the future because at some point we will begin seeking outside funding, not just through grants, but through private individuals. And luckily, Alex has an extensive network herself. Chapin is extremely well regarded in academia, so we can leverage that through his contacts within the industry. And being in technology myself for as long as I have been is also a useful tool set to us. So I don't know if that helps solve the question for you as to where those funds can come from, but that's a little bit more about how we've gotten to this stage so far.
So, Gateway has previously invited Dr. Leslie Walker to speak about AI and new emerging technology. And I want to direct this question to Alex. Can you comment on how this new and emerging technology has created the conditions for platforms such as EpiSense? And what are the impacts?
Yeah, so we are definitely watching carefully for, as like Chapin himself uses machine learning, which is, the more broad definition that includes AI in his modeling and his research. And so we definitely know the types of tools that are available to us. Right now, the limiting factor is these models are extremely data hungry. So you might have heard the thing kind of like data is king. So one of the concerns or considerations right now, in with any AI model that people should be asking is what controls have been put in place to make sure that this model is not overfitting to the data. And so sometimes if you don't have enough data and you don't have enough heterogeneity in your data to actually represent the population that you're claiming to represent, these models will always spit out something, right? You could put a picture of 4 cats into an AI model and have it trained on identifying cats. That does not mean that it's actually going to do a good job, but it'll say I did my job. Here's my model. And so coming back to some of the things that are some of the important points Leslie made in her talk was also around like equity concerns with some of these big technologies. And so you can't build AI models on limited data sets that only represent certain people because then they will be biased towards those people. So for example, if we want a model that represents everyone's true risk of, for example, getting COVID or getting the flu in Goderich, well, then we need to ensure that we have a community of users informing our model that represents the demographics of Goderich. And so one thing we're doing along these lines is ensuring that our product is designed to engage people regardless of their age or their race or their comfort with technology. So something that kind of surprised us, but we're pleasantly surprised by, is out of our current users, the strongest demographic represented is actually seniors. And we've seen this really resonating with seniors. And so as sort of tech founders, like we're in the tech space, to realize that we're actually building a technology that is accessible to seniors and seniors are engaging with it. And there's been a shockingly low amount of like customer service challenges. Like I've had a few people asking for help and helping to use the technology, but I think that that's an indicator that we're doing a good job because when I ask people, can you view it? Like my granny, who's 96, is one of our users, and like she's able to check. She's able to check her dashboard. So to me, that's informing part of our design too. And it comes back to what Leslie was saying is how when we are shaping the design of these technologies, do you ensure that there's a fair opportunity for everyone to benefit from them? So that's really informing our design principles and our engagement strategy. Yeah.
So thank you for that. And I'll direct this next question to Michael. So Michael, you have a large experience in banking and technology sales. Can you describe the experience of what it's like to be an entrepreneur in a rural healthcare space? What challenges are you currently facing that may be unique to rural areas?
Yeah, thank you for that, Sage. First off, I think it can actually be an advantage in a lot of ways. And the reason I say that is that we have the ability to be so close to our initial user base right now. Like we've done a lot of local press publications and things like that, which probably wouldn't be afforded to us in a larger community. And so that is a benefit that you just wouldn't have in a larger area. That said, probably one of the biggest challenges is connecting with some of the people that you want to be more regularly engaged with. Um, for example, like right now in Goderich, we have the BIA, which is excellent, but it's not nearly as large as the BIA that you would see in York region, for example. So you have a more limited network. You're closer to the people, which is excellent in a small community, but when you compare it to just the scale that you would see in a larger community, that's definitely a challenge. The other thing is there's a lot of fantastic events and training opportunities for young entrepreneurs in bigger cities. Um, that's simply not something that's as common in a rural space. Uh, it's really comes down to the population size that you're dealing with again. So for us, it's been really exciting to be so close to our day-to-day users and to be able to go on the radio and be featured in the paper. But at the same time, there's less companies doing kind of the same thing as us. There's not a lot of tech companies springing out of Huron County right now. We'd love to see that continue to grow, but the reality is it's just not as big here.
So Michael, in that you mentioned that there's just overall less data. And
Mhm.
in a previous episode of our webinar series, we had Dr. Leith Deacon, who talked about the importance of local data. Rural communities do have less data. So, Alex, I'll direct this to you. How does EpiSense imagine its future as a provider of local data and information?
Yeah. So, yeah, Dr. Deacon made a lot of really great points in that webinar. And one of the big takeaways is you can't cast rural with one broad brush, right? So what is going on in Goderich is going to be very different than what is going on in Owen Sound or even as close as Clinton. You can have very different conditions. And so that is why it's so important to never extrapolate your sort of your model even to regions because you think you know what's going on, to say, oh, well, we got this, we are so accurate for predicting Goderich, so let's just like say it's probably the same in Clinton. Like there's a huge risk to doing that because that's not how diseases spread. Diseases spread at different times to different places, but also the demographics might be different in different communities as well. So that is why it's important to us to develop. It's almost like a community of EpiSense users, but then there are these hyper local communities. And so each individual geographic communities benefits from using EpiSense are going to be dependent on growing a user base in those areas. So that's one of the challenges in front of us, and where it's always on our mind of how do we, when we look at expanding to places where we don't have kind of boots on the ground. It's not our neighbors that we're talking to and onboarding to using EpiSense. It's a community that the three of us don't actually live in. It's going to be more about forging those connections and having, I think, I don't want to say influencers because, but almost like influencers. We want to have that person who's a great spokesperson and believing in EpiSense and really following this model of growing local communities because each individual place is so unique. And so it needs that equivalent of a weather station, right? It's like if you only had weather stations in Goderich and Clinton, and then you're now trying to predict the weather up in Port Elgin. Like it doesn't makes sense. We all know how hyper localized the weather is, and so it's a good analogy for how hyper localized disease spread is as well.
Thank you, Alex. And even as you say that, as you are collecting that hyper local data, what steps are you taking to ensure privacy and confidentiality of the user's data?
Yeah, so our entire platform is opt-in, first of all. So we're not buying data off companies where you're under the impression it's private. The group data that we use is all the publicly published public health data. So when people are reporting symptoms and we're using that data coming from individuals, it's A, it's all opt-in, and B, it's set up to be entirely anonymous. So we're not, sometimes in the data science world, you can post collection anonymize the data, which is one step of, that's often done in clinical trials, is they anonymize what have been attached to an individual for other researchers to use it. From the get-go of our design, we literally don't know who you are when you click that report button. So we have no connections to know that that was you clicking that button, and that is feeding to a completely different storage of data set than, for example, the system that's taking like your name and email to be able to send you your newsletter. So from the get-go of our design of our technology, that report feature is set up to never have your personal details attached to us, which just protects us further from, for example, if there was something like a privacy breach, say some hacker got their hands on that file, there is no identifiable information to map back to our individuals. So that's an example of how we're going even above and beyond what kind of the baseline of requirements are for privacy and protecting our users, is to just set ourselves up with even more safety measures to say, if the worst happened, which in today's day and age, I think there's some stat like every 10 seconds a company is being like having a data breach or something. Like it's outrageous how much data breach and theft there is right now. So we want to make sure that we are being good stewards of people's data if they are trusting us with reporting their symptoms. Yeah.
So we'll send this back to Michael. As a business, how do you imagine success in the rural healthcare landscape? What does success look like for you?
Yeah, ideally, in our perfect world, EpiSense is in everyone's pocket, and it's not just limited to rural health, but it deals with cities as well and larger geographies. Um, and the reason that's what success looks like to us is we're empowering citizens, we're empowering communities. We're not reliant on single sources of data, which has become a real frustration for a number of people. And it creates conflicts depending on which side of the coin you believe someone should be on when it comes to that. So we think EpiSense is a really good middle ground there where data is anonymized, we're empowering communities. Uh, and then when you look at the downstream impacts of that, it's having the confidence and peace of mind in our healthcare systems to be able to react accordingly because they have good information to draw on. Ultimately, they're still the experts. We very much value the healthcare system here in Canada today, but we want to take some of the strain off of that. And if you want to look like bigger picture and at like more fun challenges, I would love to be able to look up what's spreading in Portugal right now. I've got a vacation I want to take the end of this year, and I would love to be able to be aware if there's any health challenges there that I should be aware of in the communities I'm going to visit. So the more people that we have utilizing tools like EpiSense, the more informed people will be able to make those decisions and they'll be empowered in their own communities.
As you continue to do more outreach and more marketing of what you've developed, what opportunities do people have to learn more about what EpiSense does, or what really drove you to create this platform?
Yeah, if you go to episense.ca, there's like an About Us section, which tells you a little bit about our founding, who we are as people, and why we think this is an important challenge to solve. Quick plug for Goderich Living here, who recently featured Alex and Chapin in an article. So if you want to know more about their personal lives and their lovely daughter and soon to be expanding family with a new dog, you can read that there. Um, but yeah, you can also reach out to us at hello@episense.ca. We're real people. We want to talk with our users. We want to help answer questions as best we can. Uh, and actually, one of the founding stories, Alex tells us way better than me. But a friend of theirs wanted to plan a trip, and they wanted to know if their newborn was going to be at risk for various diseases or illnesses in that area. And luckily for Alex, she has a epidemiologist in her back pocket. Not everyone has that. So Chapin was able to go through, do some analysis, and help provide some guidance on potential risks and help them make an informed decision. So yeah, that's sort of what we're doing here. We're just trying to make our small corner of the world a better place.
And we will have some opportunities to meet in person as well. In November, we are working
Yes.
with the Legion and also Gateway on the Wake Up Wednesday seminars. So it would be wonderful to see some people in the real world as well. I believe the dates for those are November 12th, 19th, and 26th at 9 a.m. at the Goderich Legion. And we're planning kind of a 3-set lecture series discussing preparing for winter and keeping your health and wellness in mind, and how can you set yourself up for success as we head into the dark months in Canada.
Thank you so much to our presenters for joining us on the first webinar of season 6. And we would also like to thank the following sponsors for their continued support. Without them, the lecture series would not be possible. These include CIBC Wealth Management, DeJager, Town Square IDA Pharmacy, Hurontel, Lighthouse Money Management, MacEwan and Feagan Insurance Brokers, and Zehrs Goderich. So Gateway is a not-for-profit organization with charitable status, and we greatly appreciate and welcome any support we receive. We will be continuing the conversation in October with 2 webinars. So on October 7th, we will be talking with Megan Bordeaux from the Canadian Mental Health Alliance, and on October 21st, we will be speaking with Kathy Vasilakos, Director of United Housing, about affordable housing. Thank you once again to our speakers, sponsors, and especially you for tuning in. See you in October.